The main reason we invested in the latest technology is so many advancements have occurred over the last 10 years, whether it's imaging, whether it's our ability to scan and the restorative process where we take you from the planning all the way to the restorative phase. There's so many tools out there that improve our efficiency, they improve our accuracy, they allow us to be much more minimally invasive for these procedures. And it's just of utmost importance to me to be able to provide my patients with the best technology out there to ensure that we're providing the best care possible. So that really starts with the very first thing when the patients come in the door and we sit down and we get a CT scan. And that CT scan provides us a 3D visualization of the condition of their mouth and of their jawbone. Once we gather that information, I have planning software in my system that I'm able to go in and precisely place digital template implants into the jawbone. And I sit here with you as a patient and show you exactly how I do that so you can see all the intricacies of what the procedure is and why it's so important on where the implants are placed and where they can be placed. Then we take that information and the next question is, how do you execute that? And the answer in this office is the next step of our technology, which is the Yomi robot. So with the Yomi robot, I upload that plan into the system. And then with the robot is not actively placing an implant. This is me in control of it the entire time. But the robot allows me to fully execute the procedure exactly as I planned it. And the before and afters are incredible radiographically, where I look at the implant in the planning stage. We place the implant, we get our follow-up scans, and you can see it's exactly in the right spot, right where it needs to be every time. Going from the robot, the next question is, how do we ensure that our teeth that we're going to build and the smile that we're going to build, how do we ensure that we are building something that's going to look nice and it's going to function well? And we do that with the use of intraoral scanners and extraoral scanners. And instead of the traditional way that we would do this with impressions and all the things in the patient's mouth, I'm able to do all of this digitally. And right there after the procedure, in a lot of these situations, I'm able to take all of these scans, I upload this information, all this information into my lab. My lab then designs the bridge like they would traditionally, and they send back a file to me that allows me on my laptop to review the plan, look at it, make sure that it lines up with what we planned to begin with, that we're able to deliver on the expectation of the patient. And then I approve the plan, and then that goes to our next step in technology, which is our 3D printer. Our 3D printer then allows us to print the bridge or the prosthetic that day. We take that and we deliver it. So you come in a situation where you're missing some teeth or missing all of your teeth. You go through all of this technology, and the goal is when you walk out of here at the end of your appointment, you're leaving with teeth that are permanently fixated to these implants, and it's very precise because the technology has allowed us to do that in a very consistent manner. So probably the best thing about this technology is it's not me trying to explain to a patient and communicate what I'm going to communicate to the lab so the lab can then build something to send it back that we hope works. I'm able to break this down, and the technology allows me to show the patient exactly how we get that, how the sausage is made and how we make this work, so that we set a clear expectation and we're able to deliver on that. And the technology really opens up that communication to where the patient has a very good understanding of what's going to happen and a very clear expectation. I think that the fabrication and the construction of the prosthetics, the bridges, the dentures, the things that we do is only going to get more and more efficient. That's on the back end of things. On the front end, surgically and from the procedural standpoint, what I see with the Yomi robot and the advancements and just how quickly that updates are coming and new procedures and new indications are coming with this, it's really remarkable what they've been able to do in such a relatively short amount of time that it's just kind of mind-blowing, and where I see things going from an efficiency standpoint for us as a provider, and most importantly for the patient, and to value the patient's time and reduce the amount of time that the patient has to spend in an office. If you haven't been to a dental office in a while, things have changed quite a bit. And over my last 15 years of practicing, things have changed a tremendous amount. And the equipment that I had 15 years ago is totally different than the equipment and the things that we utilize now. So I think you'll be pleasantly surprised when you come in and see the technology that you have and what we have to offer to help ensure that we are able to provide you a nice, predictable outcome.